Усім привіт! Вітаємо вас на каналі подкаст ІФНМУ. І сьогодні у нас в гостях лікар-офтальмолог зі Сполучених Штатів Америки доктор Пол. Also, he is clinical associate professor at the University of South Florida, and he had private practice during 25 years. So, Dr. Paul, welcome you on our channel. And first question from our side will be, why did you decide to become a doctor actually?
Yeah, I was at the University of California, Irvine, and studying immunology, and I started to do some research with a pediatrician who was studying the immune system in children with leukemia. And so I became interested in treating patients and in medical concerns and the research involved. And so we continued on together and did several research projects together, which eventually led to my applying for medical school.
And what was your student's life actually?
Well, student life was very busy. Many courses, the usual kind of courses with lectures and lab exercises, and it just seemed like it was one exam after another. And in those days, everything was in classrooms, in lecture halls, and in wet labs. And the time went fairly quickly. I got my undergraduate degree, and I went on and did a master's degree in immunology. And then after that, started my medical course. So student life was more studying and just a busy time. Didn't have much free time.
Okay, maybe you could share the funniest story from your student's life.
Yeah, well, that would be pretty difficult. Between work and studying and just trying to get as good grades as possible. I can't recall anything that was particularly humorous, but I enjoyed the studying, I enjoyed the learning, and really that's what keeps me going today. And that's why I've gotten involved with the medical students here, because you accumulate all this knowledge over a lifetime, and when you retire it just all disappears. And by being involved with the medical students here, you have an opportunity to go pass that knowledge along. And it's relatively easy to do, and I think it's the least that we can do to actually use the information that we've gathered over many years in a lifetime and pass it along to somebody else.
And my next question will be about residency, because as far as I know, the process of residency and fellowship is quite different in the US compared to Ukraine, for example. And for me, it's very interesting actually, because I'm already a 6-year student, and it's very interesting information for me.
Sure. Well, I started, so I went to medical school in Australia, and then I did the first half of my rotating internship in Australia. And the internship was divided into 4 segments. And so I did 3 months of anesthesia, intensive care, and 3 months of general medicine. And then I was accepted into a pediatric residency program in Toronto and Ontario in Canada at the Hospital for Sick Children. And there they had a core pediatric program that lasted 2 years. And so it took you through all the subspecialties of pediatrics. And it was really quite enjoyable. It was pretty intense, but a lot of fun as well. When you go from being a student to being an intern or resident, all of a sudden you're getting to do a lot of things. And although you're still learning, you really are, you're earning a salary, and you're really doing a lot of practical things. You're developing skills that will really benefit you and your patients throughout life. And then after I finished my first 2 years of core general pediatrics in Toronto, I took the licensing exam in Canada, which is called the LMCC. It's equivalent to the American boards. And then we had a senior resident in Toronto who was from San Diego, the University of California, San Diego, and he talked me into coming and doing my final year in pediatrics in San Diego. And it was an excellent year, a change in venue and a way to experience the American medical system as well. before I started my final year, I had to pass the American board exams. And that was pretty intense, but because I had just studied and passed the American boards, it was fairly easy to sit and pass the American boards. And we did it all in 2 or 3 days. So it was part 1, 2, and 3 of the American boards. And then I did my final year of pediatrics in San Diego. And after that, I applied for and was accepted for a pediatric ophthalmology fellowship at the Hospital for Sick Children at Great Ormond Street in London. And that was quite an experience as well, because not only was I exposed to pediatric ophthalmology there, but also to general ophthalmology. I spent a fair bit of time at Moorfields and at other hospitals in central London. So it was an exciting year. And then also I stayed on in London for 1 additional year and did part of a general ophthalmology residency. And after completing those 2 years, I was accepted to a general ophthalmology residency in Chicago at Cook County Hospital, and that's a 3-year program. And in Chicago, the training program actually extended to all of the hospitals and universities in Chicago, and so it was quite an extensive training as well. And then after Chicago, I went to UCLA and spent 1 year as a medical retina fellow with John Heckenlively, who specialized in retinitis pigmentosa. And then after that, I spent 2 years in Memphis with a retinal surgeon, Steve Charles, and mainly did surgical retina for 2 years. And then I went into private practice in Florida, where I worked for 25 odd years and then became an associate professor at the University of South Florida.
And why did you decide to be an ophthalmologist, actually, to choose this kind of specialization?
Yeah, that was interesting as well. In fact, the reason I went into pediatrics was the person that actually convinced me to go to medical school was a pediatrician, and so we were doing a lot of interesting work, particularly with childhood cancer. But when I was in Toronto at the Children's Hospital, they allowed you to have some elective rotations, and one of the rotations I took was in pediatric ophthalmology, and I really enjoyed it. And then when I got to San Diego, I was reading through the British Journal, the British Medical Journal, and 2 lead articles in the journal were from a pediatric ophthalmologist in London, David Taylor. And in those days, we didn't have email and text messaging and the internet. And so I wrote him a letter, and I got a letter back saying that they had a position for me and they had some money and that I could come and spend a year with him in London, which was fantastic, actually.
And as far as I know, it's your 21st visit in Ivano-Frankivsk.
Yes.
And it's almost in 2.5 years.
Yes.
And I'm interested, why did you decide to go in Ukraine when war was started?
Well, when I finished my private practice, a colleague of mine recruited me to come back to Memphis and look after all of the premature babies there. They had 5 very large neonatal intensive care units, and they had lost a doctor who was looking after them. And so Dr. Charles asked me to come back and work and train his doctors, his fellows, and his junior staff how to deal with the babies. And so after 3 years there, the work was essentially done. And then I went back to Florida, and I was looking for something to do. And the war broke out, and I thought, well, maybe I could somehow contribute. Early on in my life, I was actually drafted into the U.S. Army, and I spent 2 years in active duty, and one of those years was in Vietnam. I was actually in the U.S. infantry, and in fact, I was in Forrest Gump's unit on the Mekong River. And of course, Forrest Gump was fictitious, but I was in the unit that he was assigned to. And so I kind of had a feeling for what war was like and the horrors and everything that goes around. And so I thought perhaps, though, there might be something I could do to contribute. And I just didn't want to sit home and do nothing for the rest of my life. And so I started sending some emails to several of the hospitals in the west of Ukraine, and I got a few responses back, but I'd get an email and then they'd say, yes, they'd like me to come, but I wouldn't hear anything else. And finally I got connected with Dr. Fishuk, Roman Fishuk, who's an ear, nose, and throat surgeon here in Habano, and he said he could hook me up with some work here. And so first I was working in a general hospital and just a general eye clinic, and then eventually at the Children's Hospital, and started doing the pediatric ophthalmology. And then Roman also connected me with the university, which was helpful too. And I started giving some lectures and getting more involved in the program here. And it's, it's been a great experience, and I have really enjoyed interacting with the medical students and the young doctors in training, and also helping some of the other doctors as well kind of upgrade their programs. And hopefully that will continue.
Oh, yeah, we're also very happy that you are with us, because from the point of view of students, I could present their point of view. We are very happy that you could provide us some lectures and some workshops. It's very useful for us, and it's full of very necessary information for us as for future doctors. Okay, and as I understand, and as our viewers understand, you have really nice background in medical system in different countries, like Australia, the USA, and Ukraine. So maybe you could just point main differences between medical system in these countries and also medical education system.
It's interesting that most medical systems have a lot of similarities. I think the first thing, the major dichotomy that I really see in medicine in general is a big difference between medicine in the British system, in Australia, New Zealand, and the UK and Canada compared to the US. In the British system, the doctors are much better clinicians. They're much better at interacting with the patients. They're much better about, obtaining accurate histories and working through problem solving. Whereas in the U.S., it's much more tech oriented, and I think they don't do as good a job with their bedside manner, I guess is the way of thinking about it, the way they approach patients. And probably the best example of that is my partner when I was in private practice. He didn't really want to talk to the patients, or wanted to talk to them very little, because he felt when the patients were talking to him, it was slowing him down, and that he basically knew what he was going to do before he even had much of a chance to talk to them. And I think that kind of typified the way I saw medicine in the U.S. compared to British trained doctors, and that throughout the British system. When I think about the medicine in Ukraine and I also in former Soviet republics, I also volunteered back in the late 1980s and early 90s in Magadan, which is far eastern Russia. It's as far east as you can get in Russia without falling into the sea. It's a 4-hour flight from Anchorage, Alaska to Magadan, Russia. And back in 1989, I was working in Anchorage, and the state of Alaska decided to develop a collaborative project with Far Eastern Russia. They called it circumpolar health. They thought that a lot of the health issues they were having in Alaska were very similar to what they were in Far Eastern Russia. And so they put together a group of delegates, and they asked me to come along. And so I did some work in the Magadan Eye Hospital. And basically, the system is public-private, and really what we see here, and in a lot of countries too, in Eastern and Western Europe. So you have kind of a national health system like you do in the United Kingdom, and the patients are all taken care of with that system up to a certain level, and then if they decide they want to get care at another level, or if they want to pay for a different level of care, they can certainly do that. And that seems to be a similar system to what we're seeing here in Ukraine. So you have a definite dichotomy, a system of public medicine and clinics, and then also the private medicine. One major problem I see with that is really the financial side of it. The public side of the medical care system seems to be chronically underfunded, and the private system seems to have plenty of money. It would be nice to be able to figure out a way to where some of that could be shared to improve public medical care.
So my next question is, I know that you are working on the special app, and I'm interested in the role of innovation in medicine in general and in medical educational system too.
Yeah, it's interesting because one of the unique things about medicine is you are presented with problems and not only with patient illness, but also problems that you want to solve and things that you want to do better. You'll be presented with these situations where you think there's just got to be a better way of doing this, and rather than continuing to do things the same way over and over again. So one of the things that I realized when I came here was I worked with pediatric ophthalmologists, and we're looking at premature babies with a potentially blinding eye condition called retinopathy of prematurity. And the best example of someone who had that condition is the musician Stevie Wonder. He's in his mid-70s, and so he's totally blind from this condition. And nowadays, we can actually treat it virtually 100% of the time if we catch it early enough. And so we spend a lot of time examining premature babies, looking at their eyes, and particularly the retinas, and figuring out what needs to be done and when it needs to be done. And so I was at the bedside with a pediatric ophthalmologist here, and they're documenting everything on Post-it notes, essentially. And then those Post-it notes, the information gets written into a chart. And then the next week, we're examining the same group of babies again, and I would ask, well, what was the exam like last week? And they wouldn't know, or could maybe barely remember. And so I thought about, everybody has a smartphone in their pocket. And so I thought if we developed a phone app which could document in a screen or two what we were seeing, then the next time you saw the baby, you just pulled your phone out of your pocket and there would be the information. And so I met a programmer in Hamburg in Germany through another friend, and he put together an app, and we're working on improving it and deploying it. And so it sounds like a fairly complicated process, but it's not really. And once we got something that was up and running, it just became much more useful and much more practical. And we actually hope to implement it here in the next few months. And there are other folks in various other places in the world who are interested in trying it as well. Now, the other thing I realized is when I was examining babies, the little instrument we use to move the eye around, we call it a scleral depressor. It really wasn't the shape and size and exactly what I wanted. And so I met an engineer, a design person in the UK, just outside of London, and put together some ideas for the way I wanted the instrument to be designed. And in fact, have a group in just outside of London with 3D printing. And so they've taken my ideas and printed instruments that I can try. It's fairly inexpensive, and the instruments are printed in either stainless steel or titanium. So essentially they're identical to what someone would manufacture using those metals. and then you can try it on a patient, on a baby, and if there's something you don't quite like about it, well, they can just change it, almost instantaneously. So we're pretty close to kind of perfecting that as well. And there's all kinds of ideas that will come to you, throughout, your professional life, and take a step back, think about it, pull out a piece of paper, scribble down some ideas, and you may be able to come up with something that's very, very practical and will change a lot of people's lives. So, I encourage everybody to be, entrepreneurial, and it might actually end up making you a little bit of money on the side, but they're little fun projects, and it's really, kept my interest up along the way.
And for the end, for our interview, I would like ask you to share some pieces of advice to our students how to become successful doctors in future.
Well, I think probably the first thing is, never give up learning. Medicine is very dynamic, and, it is moving very, very quickly. So you can't just kind of finish medical school and not continue your education. So I think it behooves all of us to keep up with all of the advancements that are going on, not only in your own field, but also in medicine in general. So I tried to take advantage of as much educational materials as are available, and whether that's in print or now most of these things are available online. Lots of great courses, lots of Zoom conferences, and I would recommend at least attending a conference once or twice a year in person as well. The in-person conferences, I think, are critical because you get to interact with a lot of your colleagues, and it's really something that you can't get from book learning or reading journals or research articles or even Zoom conferences. I mean, they're close, but it's not the same. You get to interact with all these people in real time during things like coffee breaks and lunches and dinners, and so I think keeping your mind open and keeping learning is really probably the key to being a good doctor, and just keeping up your skill set.
Не забудьте підписатися на наш канал подкастів ФНМУ, адже будуть ще багато цікавих роликів. А також, якщо ви хочете бути в курсі усіх воркшопів та лекцій, які будуть організовані Європейською медично-студентською асоціацією спільно з доктором Полом, підписуйтесь на наш інстаграм.